Soup for Survival, a joint initiative between the Flinders Infusion Suite, FIS, the Nutrition and Dietetics Department, Spotless and the volunteers. The aim of the pitch is to improve the suitability and variety of foods and fluids available to cancer patients receiving treatment at FIS.
Look, I really appreciate the opportunity to have food in the infusion suite, but I actually don't find what's on offer to be terribly attractive and or appetising. I've had some problems with mouth ulcers, and the sandwiches are a little bit on the dry side. So I'd appreciate something, I'd appreciate a choice if I could have that. That would be fantastic. So I don't know if there's any opportunity to make a suggestion for that, but I was thinking, that I'd really I'd quite fancy some soup at some stage because it's much easier to swallow, and also I might even find myself a vegetarian alternative, which would be really good for me.
FIS provides chemotherapy to approximately 30 cancer patients per day. That's around 600 patient treatments per month. And that includes patients from metro and country, so they may have to travel a number of hours to arrive for their treatment and can be in FIS for 6 to 8 hours per treatment. Cancer patients are at high risk of malnutrition due to the increased nutritional requirements of cancer, as well as the treatment side effects that can reduce their oral intake, such as loss of appetite, nausea and vomiting, taste changes, mucositis, diarrhoea and constipation, as well as swallowing difficulties and pain, particularly in the head and neck cancers, esophageal cancers, gastric cancers and lung cancers, which means for these patients, they may be just limited to liquid diets rather than a solid diet. This is an example of what should be provided in an 8-hour period, around 6,200 kilojoules. And this is what's currently provided in FIS, just 2,800 kilojoules. Some dry crackers, biscuits and a sandwich, meeting less than 50% of nutritional requirements during this time period for a cancer patient. Based on a consumer and staff survey, just 40% of patients reported eating the sandwiches and cheese and crackers on offer, which are the high-energy, high-protein options. These options were described as not suitable because of swallowing difficulties, pain and mucositis, which meant that many patients didn't eat at all in FIS. So what's the big deal? Well, not eating and drinking enough on cancer treatment can lead to dehydration, weight loss, muscle loss, and ultimately malnutrition, decreased tolerance to treatment and dose reductions in chemotherapy, hospital admissions and increased costs to the healthcare system, and poorer quality of life. But what can we do? Well, Soup for Survival has the answer. So Soup for Survival is an initiative based on consumer feedback and a consumer-derived idea to provide soup in the Flinders Infusion Suite to promote increased oral intake. This idea has been based on a model that's currently in operation in the Royal Adelaide Hospital for a soup trolley to service the infusion suite twice a day. We already have commitment from the volunteers to bring the soup trolley around twice a day, as well as from Spotless and the Nutrition and Dietetics Department to provide a nourishing soup. All we need is the start-up funding for the trolley, the urn and the mugs to get us going. This initiative has broad benefits. To the patients, soup is well tolerated and comforting, and there'll be improved nutritional and fluid intake with greater variety on offer. And it also promotes a positive atmosphere in FIS rather than a clinical one. To families and carers, there'll be a reduction in carer burden and stress. And for staff, there'll be equity between the RA and Flinders Medical Centre, and it will also alleviate nurses and PSAs to attend to other duties rather than catering for nutritional needs. And it will be a team-based approach to promote better nutrition in the FIS Centre. And for Salin, it means that we'll have healthier and happier patients. Soup may seem simple, but this change can help cancer patients in their fight for survival. Thank you for your consideration.